Welcome to my YouTube channel. Today we are going to talk about the embryology of the esophagus. We shall do this in a very systematic way. We shall start with the sources, then the sequence of the events, then the anomalies. So it develops from its part of the foregut. So the lining of the esophagus is from the endoderm of the foregut, while the musculature and the connective tissue is derived from the splanchnic mesenchyme surrounding the foregut, meaning this is mesoderm, this is endoderm. So let's look at the sequence of the event. At week 4, or approximately at week 4, is the development of a respiratory diverticulurn at the ventral part of the foregut. So as you can see here, this is the respiratory diverticulum, and this is the ventral part of the foregut, and this is the foregut. So later, there is development of tracheoesophageal septum, which partitions the two. This is the respiratory diverticulum, and behind here we can see the foregut. So this is the dorsal part, this is the ventral part. As a result, we have the ventral part being the trachea and the dorsal part being the esophagus. And then at first the esophagus is short, but later it elongates. This is due to formation of the neck, descent of the diaphragm, descent of the heart and the lungs. Initially, the lumen of esophagus is obliterated by proliferation of endodermal cells, but later these cells break down and the esophagus is canalized. So here we can see a possibility of this event not occurring. We will get several anomalies. For example, we have seen here that the esophagus is short and it later elongates. So failure of the esophagus to elongate, we will get a short esophagus. Another one we have seen here, initially the lumen is obliterated, but it breaks down and it gets recanalized. So failure of recanalization, we will get atresia, or partial recanalization, we will get stenosis. Esophageal anomalies is the third part. So we will start with esophageal atresia. So previously we see that the lumen of the esophagus is obliterated and then it gets recanalized. So failure of recanalization of the developing esophagus, we will get esophageal atresia. So in esophageal atresia, the fetus is unable to swallow amniotic fluid. Therefore, we will have abnormal increase in amniotic fluid, producing a clinical sign called polyhydramnios. So in the newborn is able to swallow or accept the first food normally, but in subsequent feeding, it regurgitates through the mouth and the nose, and it may cause respiratory distress and cyanosis. Surgically, it can be corrected and gives an 85 survival rate. Tracheoesophageal fistula. This occurs due to the failure separation of the respiratory diverticulum from the esophagus. This is due to the nonformation of tracheoesophageal septum. So in most cases, there is a communication between the esophagus and the trachea, and the infant vomits every food he or she eats, and there is presence of air in the stomach, and that's the diagnostic sign of the tracheoesophageal fistula. Achalasia cardia. So this is the normal esophagus, and this is the esophageal achalasia. So as you can see here, compared to the normal one, the lower part of the esophagus seems like it is constructed or constricted or somehow that. So it occurs due to the failure of the relaxation of the musculature of the lower part of the esophagus, following loss of ganglionic cells of Aurbach plexus. So Aurbach plexus is also called enteric nerve plexus. So clinically, the patient complains of difficulty in swallowing, and on a barium swallow, as you can see here, the esophagus, the upper part is dilated, and the lower part seems like a very thin part, and it presents like bad beak deformity. Esophageal stenosis. As you can remember, we say that the esophagus lumen is obliterated and then it undergoes recanalization. So incomplete esophageal recanalization will lead to esophageal stenosis. Short esophagus. As we talked about in the sequence of the event, we said at first the esophagus is short, but later it elongates during development. So failure to elongate during development, you will get a short esophagus. And the esophagus is connected to the stomach. So when it fails to elongate, the stomach will be pulled up into the esophageal hiatus of diaphragm. and therefore we will have a congenital hiatal hernia.